Do you want to know about one of my favorite procedures that could really enhance your smile in 1 hour? So let's talk about in-office teeth whitening. In-office teeth whitening is an amazing way that you can brighten your teeth and with little to no downtime. Let me tell you the difference between getting your teeth whitened like with something over the counter versus bleach trays that you may pick up versus an in-office whitening treatment. So when you get over-the-counter bleaching products, they're somewhere between 1 to 5% hydrogen peroxide, which will give you some results, but it takes a while and the results aren't that significant. One step up from that is gonna be doing an actual, like picking up trays from your dental office that were specifically made for you, and then you'll get a higher strength bleach from your dentist. It's usually somewhere around 14% hydrogen peroxide. So you can see there's a huge difference between 1 or 5% to 14%. So you'll see results more quickly. And I actually like the results from that. But something even better than that is to do an in-office whitening treatment. Why I love in-office whitening treatments so much comes down to so many factors. One, we use a prescription strength bleach in the office. Usually it's about 25% hydrogen peroxide depending on what system you're using. The other thing about it is that we isolate all of your tissues, so you reduce the risk of actually burning your tissues. And the other thing that's really important is you prevent the saliva from contaminating the bleach that you put on your teeth, so that bleach can actually be as effective as possible. So that's why I love in-office whitening procedures. So what we do is we isolate all the tissues, we put the bleach on, and every 15 minutes we come in and we switch out the bleaching agent. And so it's 1 hour in the office. You see results pretty much right away as soon as you're done, and there's little to no downtime. Now, a lot of patients will say that they've had their teeth whitened before and they were extremely sensitive. I totally get it. I have such sensitive teeth myself. Even drinking like room temperature water sometimes makes my teeth sensitive. I'm not even joking. So because of this, a few years ago, I went out on a quest to find a way that we can whiten people's teeth in the office without them having so much sensitivity. So I'm gonna give you a quick overview of some of the things that we do. One is if we're doing a treatment for a patient and they already know they have sensitive teeth or they're worried about it, we have specific agents that we apply that don't affect the effects you'll get from the whitening treatment. Like you'll still get the same amount of whitening, but it will help reduce any post-op sensitivity. And then what I'll say, so we have products that do this. We also have a light that doesn't have certain components to it. Like we used to use a UV light, now it's a different type of light, so there's no heat component to it. So that helps reduce the sensitivity as well. And then I give instructions for before and after. Sometimes I'll have my patients brush with a certain product with a certain toothpaste before, something that might have fluoride in it to help prevent sensitivity. Like I'll have them do it 1 or 2 weeks ahead of time so that when they come in, there's already been some fluoride infused in their teeth. It won't affect the effects of the bleaching. You'll still get really good results, but after that, it really minimizes the amount of sensitivity you could have. And then for the post-op instructions, I always tell my patients, besides the normal, like you don't want to have coffee, tea, red wine, or anything because it'll stain your teeth even more. But to help with the sensitivity portion, I say nothing that is too hot, nothing that is too cold, because the sensitivity comes from the temperature differences, and also nothing that's really acidic. So like oranges or lemons or pineapple can make your teeth more sensitive because they're more acidic versus like neutral things that won't make your teeth as sensitive. So those are just some kind of tips that I give. What happens is when you apply bleach to your teeth are made up of, if you want to think about it, like first there's the enamel and then there's what's underneath the enamel, which is called the dentin. And the dentin is kind of like little straws that are lined up. And when you apply the bleach, they're called dentinal tubules. They expand, so they allow the bleach to kind of seep in, and then they're open. And then there's fluid that flows through those dentinal tubules. And what happens is when you're sensitive, you're feeling that fluid moving through the dentinal tubules. So a lot of the things that I'm talking about will help minimize that sensitivity, just because you'll have like fluoride going in there, or you won't have so much like extreme temperatures that will throw that off. And it takes 48 hours for those dentinal tubules to close. One thing I want to mention is that of all my patients that have done this, even though it can take 48 hours for the sensitivity to go away, I've never, of all the years I've been doing this, I've never had anyone who's been sensitive for 2 days. Normally what happens is we bleach their teeth in the office, they're sensitive that day, and then when they wake up the next morning, it's like brand new white smile, like nothing really happened, and that is amazing. I've done this to myself, seen great results with it, and I offer it to my patients, and we do it so much in my office that I know that this works. So if you guys have any questions, make sure to leave them below this video. I'm happy to answer them for you.